Ever since we started the Indian Diabetes Review in 2011, that was what it was called in those days, we have received so many messages and emails from people in the lower income group asking us about the ways and means of meeting the cost of diabetes treatment. The cost of diabetes related complications can be even more dire, but the fact remains, for the people in the lower income group, the cost of treatment of diabetes is a life and death matter. More than a decade ago, I had gone to Pune to meet an NGO which helps poor families deal with type 1 diabetes in kids. I was actually shocked to see the prevalence of type 1 diabetes in Pune city. One of the officials in the NGO told me that type 1 diabetes is a non-issue amongst poor families, and that's because it does not have any painful symptoms. Most of the kids who suffer from type 1 diabetes in poor families simply die of ketoacidosis. In these days of high cost of living, how do diabetics manage the cost of treatment, testing, consultancy, the cost of drugs and insulin? Hello and welcome to this special podcast on diabetes and its related complications. My name is Parameswaran Nair, and from Mumbai in India, this is Diabetes Renal Post. The problem is also with the symptoms of diabetes. Anyone with 350 milligram per deciliter of blood sugar can go about their routine as if everything was normal. Fortunately or unfortunately, diabetes symptoms don't involve pain, and that is why people on the margins of hyperglycemia completely ignore their health emergency. I know of a young guy in Dubai who has a blood sugar of 300, and he came to know about it during a holiday fest in office when the local lab did free testing for all employees. He started his treatment almost 4 months later when he came back to India. The attendant problem for Indians in Dubai is that they want to earn and save as much money as possible so that they can come back to India early. And in that deal, they will skip all kinds of medical expenses and treatments. To make matters worse, diabetes does not have any kind of painful symptoms. Many diabetologists, mostly young generation, provide free consultation, sample drugs and insulin for the poor. But they are few and far between. And why should the doctors alone bear the cross? After all, the government has to provide free healthcare for the poor. It's not that the government hospitals don't provide treatment for diabetes for the poor, but the treatments are quite sketchy, especially in rural areas. The real issue is the lack of education amongst patients. They don't understand the intricacies of diabetes treatment, and the most important issue is the distance that poor people have to travel to access free healthcare. Healthcare professionals and activists estimate that of the 7.4 crore diabetics in India, more than 1.5 crore people cannot afford the cost of treatment. What that means essentially would be that poor people who cannot afford the treatment cost would go into slow death because of consequent organ failure. 30 years ago, diabetes was considered to be a rich man's disease, but today almost every family, be it rich or poor, has at least one member with high blood sugar. Is it not alarming that more than 1 crore people in this country have just given up on their life because they can't afford the cost of treatment of diabetes? Insurance can be quite tricky, as many of the kidney patients have found, much to their chagrin. In case of CKD, the cost of dialysis, the cost of drugs, the cost of transplant, the cost of post-transplant cost can all be so high that even the middle class won't be able to afford it. In a recent journey to Bangalore, I met up with a doctor in the train who told me that hypoglycemia amongst poor people can be quite adverse because regular food intake itself is not certain. And in an interview with a diabetologist in Thane, Dr. Mahendra Patel, he said that the cause for diabetes is basically two reasons. One is fast food and the other is sedentary lifestyle. Eating less, eschewing fast food even during office parties, and walking short distances for daily chores can actually help you in bringing down your blood sugar. I can also vouch for one more thing. If you give up your personal vehicle, be it a motorbike or a car, and start using public transport, it will be a much healthier way of living. Your stress levels will go down if you stop riding or driving. There are charity organizations that can help diabetics, but there might be people who are more needy. You can talk to your diabetologist or your family doctor, because these charity organizations usually get in touch with the local health professionals to find out who needs help. You can also talk to hospitals which treat diabetes and diabetes related disorders, because they also have such schemes and they also are in touch with charity organizations to help poor people. One of the popular ways of meeting the diabetes treatment cost is through insurance, although I have very little faith in them. I have seen insurance companies wriggle out of payment by saying that it is a pre-existing disease or it is age-related disorder. I have even seen insurance companies refusing to pay, although you have been paying premium for years. So if you have a successful insurance payment for diabetes treatment, you should take it as God sent. You can even register yourself with the hospital that treats diabetes and diabetes related disorders. They will put you onto NGOs who can help you access cheaper drugs and cheaper dialysis. I am actually amazed to see doctors from top corporate hospitals helping needy patients, especially indigent patients, to access cheaper drugs. In the US, the average annual cost of diabetes management is about $12,000. But in India, it's just a fraction of that at about 13,000 rupees every year. But for a country where the salaries are dipping, unemployment is at a record high, inflation has gone through the roof, and diabetes has gained epidemic proportions, the cost of diabetes management for people in the lower income strata can be unbearable. Mind you, in the US, dialysis is completely free for indigent patients, and the dialyzer is never reused, it's only used once. In India, one erythropoietin injection that has to be taken once in a week for dialysis patients to boost their hemoglobin can cost up to 1,500 rupees. So you know how bad it can get. Okay, let me tell you an anecdote. Recently, I was admitted to a corporate hospital, a well-known corporate hospital which is known for its best-in-class laboratory, pathology laboratory. And that was 3 weeks after a wild goose chase, when I was admitted to a hospital earlier and they couldn't find out what was wrong with me. At this corporate hospital, they found that I had bacterial infection in blood. The doctors in this corporate hospital and their pathology lab did a wonderful job. But what really shocked me was the flow of poor patients to this top-notch corporate hospital in Mumbai under the Ayushman Bharat scheme. In 3 days, I must have seen at least 2 indigent patients who were admitted to the same ward as I was and given perfect treatment with no discrimination whatsoever. No wonder some politicians win election after election because of their policy decisions. In India, the cost of managing diabetes can be anywhere between 2,000 rupees to 10,000 rupees per month for doctor consultation, for drugs, insulin, and testing, regular testing. Now, when diabetes related complications start showing up, the cost will multiply by at least 4 to 5 times, and that is after about 12 to 15 years of controlled diabetes. If it is uncontrolled diabetes, it can get worse in terms of suffering, cost, and stress. For a CKD patient who has undergone transplant, the cost of drugs, testing, and doctor's consultation fee will be at least, being very conservative here, will be at least 15,000 rupees per month. There has been an avalanche of generic medicines in the market which can bring the cost down. But as Dr. Mahendra Patel said, if you give up your motorbike and car, you will be forced to walk and be active, and that can bring your diabetes under control. If you give up fast food and have smaller portions during meals, it can obviously help you in controlling diabetes and thereby the cost. It's also very important to have vegetable salad every day to bring up your hemoglobin levels and also make you sprightly and in a vivacious mood. Another way of controlling medical costs is to have a household budget, and that household budget should have a 20% buffer amount so that you will not be taken by nasty surprises by the end of the month. It's very important to prioritize diabetes management and never skip the blood sugar testing at home, because hypoglycemia and hypoglycemia cannot be estimated correctly by the diabetic himself without the blood sugar test. I know of a young type 2 diabetic who works in a marketing job. In the morning one day, he met a few clients in Andheri MIDC, and by afternoon he was at his office in BKC. He was feeling tired, his legs were a little disoriented, his eyesight had become hazy, and he suspected that it is hyperglycemia. So he went to the washroom, had his afternoon dose of insulin, and then ordered food on Zomato. Thankfully, Zomato delivered the food on time, and by the time he started eating, he realized that he was getting into hypo. He also told me that when he was having lunch on that day in his cafeteria, he could see colored balloons filling up the room. Such images appear when you are getting into severe hypoglycemia. His golden rule is that you should never take an insulin shot without testing your blood sugar. And then when you take your insulin shot, you should also know how to titrate it according to the food that you're having, the amount of food that you're having, and the amount of exercise you have already done, probably walking to the office. It's quite a complicated combination. Thankfully, the sugar testing strips have become much better in quality even as the costs have gone down. If you buy it in bulk along with medicines, you can get a remarkable discount. Today, the sugar testing strip, each sugar testing strip would cost about 12 rupees, which is much better than getting into hypoglycemia, calling up the emergency services, landing up in the hospital, and paying for the treatment. Okay, one more thing. Yoga can help in managing diabetes and bringing the expenses down. Yoga can bring down the stress levels, improve your gastric system, improve hemoglobin levels, and put a spring in your feet. You become more cheerful and sprightly. You should also join local groups to understand what's going on in your vicinity in regard to doctors and healthcare facilities that can help you hugely in diabetes management. Telemedicine is yet another way of bringing down the cost of diabetes management because the doctor's fees are lesser and you can save on the transport cost. It's very important that you nip diabetes in the bud, because once you contract type 2 diabetes, the related complications will follow very soon. And the cost of managing the related complications can be so huge that it can become unaffordable even for a middle class family. Diabetes related complications can involve heart, brain, kidney, eyes, feet, nervous system, what have you. So if you are on a shoestring budget, you better nip the diabetes in the bud. I'll say that again.